the approach that I will follow is to explain the pathway that food goes from the mouth, and then specifically concentrating on the pathway of food in the peritoneal cavity. But what we can show here, over and above the mouth, the teeth and aging of animals, we've got the vestibulum oris between the teeth and the gums, like that, and then the cavum oris proper, that is the proper cavity between the teeth and the tongue, extending then further backwards. And what I've dissected here and what I show is just the arrangement of the soft palate there, which in the breathing state is hooked under the epiglottis, and when the animal swallows, if I can show by pulling between the two instruments, you can see that the left and right arcus palatopharyngeus come together, and that closes off the nasopharynx up there. So therefore food cannot go in that way, but can only go down the esophagus. Then in this animal, the esophagus has been cut and it continues there, and we can see the esophagus in the pathway in the neck. And then the pathway of the esophagus in the thorax we cannot see in this dissection. We've done that in many other dissections during the year. So I will continue then by taking the topography into consideration in the peritoneal cavity. We have to do the palpation from dorsally. We removed the lumbar region, and that is in order for students to put their hands in, both hands, and to palpate, because the purpose of this exercise is to go in with gloved hands and enough liquid paraffin on the left and the right hand side, and then palpate all the structures that you have to follow. In other words, from the esophagus coming in to the abomasum, which is behind the diaphragm, and we've done the topography of that basically. So students have to palpate the abomasum. One way of identifying the abomasum here on the right hand side deep is to try and follow the duodenum descendens cranially until you get to the turris pyloricus, which is deep there on the deep side of the liver. That helps to follow the rest of the pathway. So that would be descending duodenum. There would be ascending duodenum going up there, and if I open this up, you can see where the duodenum ascendens goes over into the jejunum, and it's on the left hand side of the ascending colon spiral, which you can see here, and then that becomes the jejunum on the periphery. If I lift this out, on the periphery of the intestinal tract, and maybe it's better if I can force it out from the left hand side. There you can see the jejunum on the periphery of the flat ascending colon spiral. I'm going to replace this back. So food would then go in the jejunum, then the ascending colon spiral. There's the cecum, and the last part of the jejunum is the ileum, which we can see there. That is the ileum. So food then goes via the ileum into cecum, ascending colon, and I've done the ascending colon spiral. From there it goes out to the transverse and descending colon, of which I can only show the descending colon here. And we can see the rest of the descending colon, and if I tear this open, this is peritoneum, we can see how the descending colon goes out further. That is the bladder, because we've removed the sacrum here, so we can see into the pelvic cavity. To recap a little bit further on the rumen, if the rumen is this structure here between my hands, we can see that it's attached dorsally, and part of the spleen is included in that attachment. The rest of the rumen is free, and because the rumen is free, except for that attachment, one can put your hand in on the right hand side of the rumen as well. You can go forward and you can palpate the omasum, the contents of the rumen, dorsal sac and ventral sac. Everything is open up to the peritoneal cavity here at the back, and it's all continuous. And you can see that jejunum is going into the peritoneal cavity, and why we've got this specimen here, because we haven't seen it. That structure there is Peyer's patches. We haven't seen it in the others, so seeing that now would help. And if I can just reflect this out, you can see that this cavity in which all these intestines lie if I can lift them out, that is the recessus supraumentalis. So all the intestine, small and large, fills this space between the right-hand side of the rumen and the duodenum on the other side. If it's a female animal and the female animal is pregnant, the pregnant uterus would also lie in that position. The students will have to do this carefully because the next time we're going to do this whole palpation blindfolded.